1 hour of nursing continuing education will be available. Participants must complete the evaluation and post-test for credit. We will share the evaluation and CE link near the end of the presentation in the chat, and it will also be sent out along with any resources shared by presenters to those who registered. If you could put your questions in the chat, we will try to leave time for a question and answer portion after our speakers present if time permits. Please take a moment to introduce yourself. I'm going to go ahead and introduce our first speaker today. Our first speaker is Dr. Courtney Kerrigan. Dr. Kerrigan is an assistant professor at Michigan State University who applies her expertise in exposure science and epidemiology to investigate human exposure to environmental contaminants and effects on reproductive and child health. For the past decade, her work has focused on exposure and health effects of the PFAS forever chemicals, with emphasis on translating research into health protective action. This includes helping lead the PFAS Exchange as an online resource for PFAS-impacted communities, developing CME training for PFAS, co-chairing the National PFAS Conference, and supporting the National Academy's guidance on PFAS exposure testing and clinical follow-up. Dr. Kerrigan has a joint appointment in the Department of Food Science and Human Nutrition and the Department of Pharmacology and Toxicology at MSU. She completed postdoctoral training at the Harvard T.H. Chan School of Public Health and holds a PhD in environmental health from the Boston University School of Public Health. A native of New Hampshire, she was awarded a scholarship to Rutgers University over 20 years ago, where she completed a BS in biological sciences. And subsequently, she became committed to protecting environmental public health after working on contaminated sites for a diversity of communities across the Northeast. So, Dr. Kerrigan, I'm going to turn it over to you.
Thank you so much. It's a pleasure to be here. I have a lot of slides, so I'm just going to jump right into it. I'm going to jump right into it just a minute. I'm trying to fix my screen so I can see people. Okay. So today I'm going to talk to you guys about PFAS, give you some background. I'm going to share some community perspectives. I'm going to talk about an online resource called the PFAS Exchange and our new CME, and give a brief overview of the National Academy's guidance and some practical steps that people can take when in a clinical practice. So PFAS are a class of more than 20,000 chemicals that are used widely in many products to provide stain, grease, water, and fire resistance. In addition to those shown here, I've tried to list some others, but this is not a comprehensive list. It's a wide variety of products that they're used in. They're characterized by this carbon backbone that the carbons are attached to fluorines, and there's a varying number of carbons or fluorines depending on which PFAS we're talking about. They also have a functional group. And this is a useful property with one end that attracts and the other that repels substances like water. Also, the carbon-fluorine bond is incredibly stable in the environment, and it's difficult for our bodies to eliminate. Some PFAS are very persistent, so like for geologic time in the environment, and this extreme persistence has earned them the name forever chemicals. PFOA and PFOS, called C8 because they have 8 carbons, were phased out of use over a decade ago. But hundreds of other PFASs are currently in use, and there's mounting evidence that these chemical cousins can also be harmful. The unique properties that make them useful also allows them to migrate easily from industrial plants and products into our drinking water and food. Groundwater plumes for PFAS are about 10 times larger than other common groundwater contaminants like industrial solvents, and they're found in most wastewater treatment plants, surface water bodies, and sludge, which are often turned into biosolids. This exposure pathway figure is also highlighting ways that workers can be exposed, and also that the general population can be exposed both through consumer products as well as through the environment. And in this exposure pathway figure, I'm highlighting that after the occupational and drinking water exposure pathways, which are very important if you have contamination in those settings, for the general population, diet is a primary exposure pathway. So this is highlighting pathways via food contact materials, as well as via the waste and environmental pathways. And PFAS, like other persistent organic pollutants, bioaccumulate in animals over time because they're eliminated from the body very slowly. And they can also biomagnify up the food chain, particularly the longer chain, more persistent PFASs, the ones that persist longer in the body. So this accumulation in animals is more pronounced for the longer chain PFASs like PFOA and PFOS because they're eliminated from the body very slowly. And PFASs can also be taken up by plants with higher uptake for those with shorter chain lengths. So a lot of the current use PFASs, for example. And this dichotomy further complicates the kinds of modeling that I do in my work. PFASs are found in the bodies of most Americans. Fetuses, and children are especially vulnerable during critical windows of development. Babies are born with the same level as their mothers and are further exposed through breast milk. Infant blood levels can rise further after birth from breastfeeding or formula, and particularly when the formula is mixed with contaminated water. Of the hundreds of studies on health effects, almost all have focused on PFOA and PFOS, which are historically the most prevalent. They have been found to affect multiple systems of the body and have been linked with a wide array of health concerns, including those listed here. These are the probable links from the C8 Health Study, which is a very large epidemiologic study conducted in West Virginia. And this is a little more up-to-date list that includes effects on the immune system, liver, reproduction, and some other effects. About 8 years ago, I contributed to a study that estimated over 6 million Americans have been served by drinking water systems containing elevated concentrations of PFAS. We also found that systems were more likely to be contaminated with closer proximity to industrial sites manufacturing PFAS, military fire training areas, AFFF certified airports, and wastewater treatment plants. Some of you may have seen this figure. This is from the Environmental Working Group, or this map. And what this is showing is that military sites across the US have been sampled for tested for PFAS. And the blue dots are showing drinking water systems that have been tested. And what you see is that there's more testing in some states than other states. So very unequal testing across the US when this map was last updated. And this is from our PFAS Exchange website, which I'm going to talk about in a minute. We have a mapping tool, and this is showing PFAS sites and uses color coding to show where the higher concentrations have been found. So this is not drinking water in this map. This is PFAS sites. We also have this map on our PFAS Exchange tool, which is showing communities that have PFAS contamination. But again, this is limited by where PFAS testing is happening. So I'm going to go through a few examples here in Michigan, just to give you some examples of PFAS exposure pathways. So the former Ward-Smith Air Force Base in Oscoda, Michigan was one of the, if not the first, PFAS contaminated site discovered in the US. This was about over 15 years ago, and it was from the use of specialized firefighting foam and use of that foam in hangar suppression system. This has contaminated the base as well as the base and residential water in the area, as well as the adjacent Van Etten Lake, Clark's Marsh, and Ausable River. And this river discharges into Lake Huron, which is shown there on the right. This foam is called aqueous film forming foam, or AFFF. It's been used extensively by firefighters in training. It's used to fight fuel fires. And the firefighters were told that it was as safe as soap and water, and they used it as such. Often they were not wearing the protective PPE when training with it that you see here, and even did things like foam parties for themselves and for children. This has helped contribute to also exposure through drinking water, because PFAS migrate very easily into groundwater, and also do not eat advisories like for fish and for venison, and even some home gardens. This is a paper that I helped publish that was reporting on very high levels of PFAS in surface water foam for the lake that I showed, and contributed to an advisory to avoid eating or touching the foam in the lake. Another site you might have heard of is in Rockford, Michigan, that resulted from poor disposal of tannery waste at dumping sites across Rockford and Belmont, and contaminated private drinking water wells with some very high concentrations in some wells. These wells have had to have filters put on them or be connected to public water. And we know that granular activated carbon filters will help filter PFAS out, and that reverse osmosis filters, point of use filters, can do that a little bit better. And either way, regular maintenance of these filters is very important, because once they're saturated, they will offload the PFAS into the water. Municipal water systems can change the public water supply to a cleaner source, and can also use very large filters. And if you want to get the shorter chains out and improve filtration, you can use special filters that improve the granular activated carbon filtration. Many states have been setting their own drinking water standards, so Michigan is among these. And Michigan has also done statewide testing of drinking water systems, and you can find data specific to your community on their online mapping tool. EPA recently set drinking water standards. This is a historic, very exciting happening. And I'm just showing them here, and I want to highlight that for PFOA and PFOS, the goal has been set at 0, so a closer to 0 approach for these PFAS is based on the current health data, and the enforceable levels have been set at what most labs are able to detect down to. So it's basically, if it's detectable, we're trying to remove it. And this is an equation that I'm not going to get into in the interest of time. The UCMR5 program has been doing testing and so far has found that about 10% of public water systems are exceeding the MCL. Another example is for paper mill. So this one's in the southwestern part of the state where PFAS were added to the paper pulp for making grease-resistant and water-resistant papers, such as the ones shown here. So popcorn bags, microwave popcorn bags are kind of notorious for containing PFAS, and people who eat more microwave popcorn have been found to have higher levels of PFAS in their blood. There is now action being taken by the FDA to phase these out, and many suppliers, many fast food companies have committed to no longer using PFAS in their packaging. In this case, the paper pulp was disposed of in a landfill that was near the municipal wells. So this is how the wells got contaminated. And here I'm contrasting the levels in the wells, the public drinking water, to the levels that EPA is now regulating on. And just to highlight that there's many different types of PFASs. So often we're monitoring for the PFCAs and the PFSAs. And this is just highlighting, I have a study in this community that in the current public drinking water, which you can see the levels are much lower than they used to be, the ones in hatching are ones that are not typically monitored for. So you can see about half the concentration currently in the public water are PFASs that we don't typically look for and that we don't have reference doses for. Another thing that I'm doing in this community, I've been monitoring and estimating exposure through local and home produced foods, and have found that this can be a source of both elevated exposure historically, as well as potentially ongoing in some cases. Another scenario I want to highlight was chrome plating in the Huron River area. So this is where chrome plating industries uses PFAS as a fume suppression in foam plating. This is discharged into the wastewater treatment plant, which does not actually remove PFAS. And so then the PFAS passes through the wastewater treatment plant into the river, as well into biosolids that are land applied. So Michigan has started doing, or has implemented, a pre-treatment program to help limit the influence of PFOA and PFOS into the wastewater treatment plants. However, it's too late in some places, like in the Huron River where this was happening. And so now there are do not eat fish advisories across the Huron River, and you can see concentrations PFAS in fish up to 1,000 parts per billion. And so contrast that with levels that we see in Great Lakes fish, kind of in the 20 parts per billion range. And we can contrast that to a paper I recently helped write that's showing PFOS consumption advisories. You can see that these are falling into advisories not to eat more than 1 per week in that 20 parts per billion range, but that in other states, the recommendation is lower. So it really varies by state, and that has to do with how you do the calculation. Another pathway is the biosolids being spread on farms. So there's one farm here in Michigan that was actually shut down because of the biosolids being contaminated, unknown to the farmer, years ago, and ended up in the beef. And this has been happening in other states as well. Maine and Michigan are the two that have been looking and taking action on this primarily. Another pathway is through compostable packaging. So I think this is better known now and hopefully isn't still happening, but some compostable packaging can contain PFAS and so then can result in exposure through this pathway. And this is just a resource for looking at screening levels that has come out of Maine. I'm just going to jump through. So also here's some protections there for food. And some talking about primary exposure pathways. I got to just jump right through this because I want to get to the next part, which is talking about contaminant communities. So in addition to supporting action on PFAS, contaminant communities also want access to blood testing. We've been hearing from communities about this a lot, and this is what led us to develop some of the materials I'm going to talk about. They talk about dismissiveness of doctors, and that's just really not acceptable. So I helped publish this op-ed in Environmental Health and News, which highlights the importance of medical screening and highlights stories, including one of Sandy Winstelt, who is from the Belmont community. She lost her husband, Joel, a year before learning that very high levels in her private drinking water well. She was able to get her blood tested through her lawyers, actually, and shared those results with her doctor, who put it on her file. And then when she started having strange symptoms, was able to more quickly diagnose her with thyroid cancer. She was able to get treated and now has a good prognosis. So if you go to our PFAS Exchange website at pfas-exchange.org and navigate to resources, you'll find a bunch of fact sheets. You'll find this PFAS blood testing fact sheet there. And one important thing in that fact sheet is these CBT codes. And so these are codes that you can use to order a blood test for somebody who suspects or knows that they've had an elevated exposure. You can also navigate to these medical screening guidance that we develop, these companion guidance for people in PFAS impacted communities and their clinicians. And you can provide these to your patient, and you can also use them for your own reference. You can go to, once you've got your PFAS blood test results for your patient, you can go to our What's My Exposure tool. That will provide you with context-rich information. You can put the numbers in, and it will compare to the general population and give you some contextual information. You can also go to our mapping tool, which I mentioned before. This is showing presumptive sites. So what you can see here from in comparison to the other maps is that there are sources across the country, especially where there's more people, you see more presumptive sites. Another thing you can see on our resources page, if you scroll down, scroll is we have a resources for clinicians page that you can go to. And if you go there, you'll find our CME is publicly available. And if you scroll down, you'll find more resources for clinicians. And you can also now go to the MSU College of Osteopathic Medicine CME page. I put a QR code there to make it easy, and you can get CME for credit. So if you know other people who'd like to get CME, weren't able to attend, they can go there for that. And these are some of the experts. Alan Ducketman has been providing medical treatment and advice to those affected by PFAS in the West Virginia area from the Parkersburg plant, including from the Parkersburg area for 20 years now. And we also feature presentations from people impacted by PFAS contamination, including Sandy. We are happy to be a part of the National Academy's report, providing guidance on PFAS testing and health outcomes for clinicians, and you can find this online, it's free. And highlighting the framework that they used, and particularly the foundational principles that included autonomy. They did a literature review and synthesized that data. They used categories of strength of evidence, and just noting that this limited suggestive evidence category can mean, or often means, that there just aren't very many studies. So when advising patients seeking exposure reduction, you can talk with the patient to determine if and how they may be exposed, advise those with occupational exposures to consult with an occupational health clinician, those with elevated PFAS in drinking water to use and maintain filters, those living in areas of known PFAS contamination, that PFAS can be present in fish, wildlife, meat, and dairy. And for infants, you can discuss steps that can lower source of exposure, such as by mixing formula with safe water. So PFAS testing and levels can also inform clinical care. Testing should be offered to patients with elevated PFAS exposure. Benefits of this is it helps people to better understand and mitigate their exposure, and exposure levels can inform clinical follow-up. Some limitations are that they do not predict likelihood of a health effect, as individual risks vary. Levels in blood decrease over time, and that decline varies by PFAS, and it may increase stress or health concerns, although it also may decrease them. Some people will say that the uncertainty is more stressful, so the not knowing is worse than the knowing. But whether to test requires shared informed decision-making, so everybody is different. The committee used existing guidance for clinical follow-up to make their recommendations for those between, so we talk about this being the NASEM 6, so summing these 6 PFAS and then comparing to these concentrations. Many people will fall within this 2 to 20 range, and the recommendation here is basically what you get during a typical physical. And that those that fall over 20 parts per billion, there are some additional recommendations for clinical follow-up. So these are those tests highlighted here. I don't have time to get into this, but just for your reference, this is some exercise I sometimes do with people who want to help contextualize their understanding or your understanding of population inference of risk. And this is just reviewing everything I just said, with an additional note at the bottom that those with notably high PFOS might consider a 6-week course of cholestyramine. And you can see more information about that in our clinician guidance, medical screening guidance companion document. And there's also a new paper that was published with results of a clinical trial showing both the efficacy and safety of that treatment. Our National PFAS Conference was just in Ann Arbor. We have recordings from that. I co-hosted that or co-chaired that with the Great Lakes PFAS Action Network. And we have the Michigan Story session online, and we'll have the rest up soon in terms of recordings that are available. This is Rob Balot. He's the lawyer that sort of discovered PFAS. We gave him an award at our meeting, but his story is featured in the motion picture called Dark Waters. If this is interesting to you, it's a dramatization of the true story of PFAS discovery. And then I also do some work on helping EPA strengthen their chemical policy. And there's some really interesting, good fact sheets from the Science Action Network. So I put that here. I want to thank everybody from our PFAS Reach team in developing the PFAS Exchange, including our Scientific Advisory Board. I want to share my declarations and disclaimer that funders do not necessarily share the views expressed here. And thank you all for your attention.
Thank you so much, Dr. Kerrigan. I'm just going to briefly review the anti-PFAS toolkit, which you can find on our website. I will be very brief because we have another speaker, but I just wanted to highlight some of the things in the toolkit. Great. So as I said at the beginning of the webinar, my name is Sarah Bucic, and I'm with Annie, a policy consultant, and I was one of the people that helped work on Annie's PFAS toolkit. Dr. Kerrigan mentioned some of these things, but the background to all this is that the EPA this year did come up with regulations for 6 PFAS. And so we anticipate with these new regulations that we're going to start seeing more and more patients coming into practices, wanting advice and wanting guidance, and we want to give clinicians everything that they need for that. There's also been an incredible amount of funding from the Biden-Harris administration, from the Bipartisan Infrastructure Law, and also from the Inflation Reduction Act. So a lot of that funding is supporting the getting the PFAS out of water supplies. Our toolkit is a fantastic resource. What we did was we took the National Academies of Science, Engineering, and Medicine report, and that's about 300 pages. Dr. Kerrigan mentioned that, and we made ours much shorter, and we kind of highlighted it so that clinicians can use this toolkit when they're in their practice. Our toolkit covers a number of things. You can scan the QR code. I'll also put in the chat the link to get our toolkit. It covers talking to patients and communities. It covers clinical testing, lab results interpretation, clinical management, and clinical follow-up. One of the main things that has emerged with PFAS is the science is really, it's ongoing. It's still emerging, and there's a lot of uncertainty. So we want to really be honest with patients about what we know and what we don't know. What we do know is that with decreased exposure, PFAS levels do come down. So we want to review potential exposure for our patients. We want to acknowledge there are a number of unknowns. And then also we want to talk to patients about various concerns that they might have with their own health. Our toolkit also covers clinical testing. There's actually an instrument in the toolkit that can help you assess to see if your patient has been exposed, if they've had occupational exposures, if they've had documented contamination. We really encourage providers to know what is the documented contamination in communities so that you could be aware of those things when you're talking to patients. We also want to ask our patients if they regularly consume fish from PFAS contaminated water bodies. Here's the exposure assessment questionnaire that I referenced. It is in our toolkit, and it's compiled from a number of different sources, but it's really handy, and you can do it right in your office or at the bedside. One of the things with PFAS testing is there are no standard methods for PFAS exposure biomonitoring. So as Dr. Kerrigan mentioned, there are limitations with PFAS testing. It doesn't identify the source or predict health outcomes. It can guide the clinician about what kind of tests might be warranted, but also the labs only test for a small amount of PFAS. So we want to be really open with our patients and, talk about, what this says and what this is, isn't able to say yet. And as we know, blood testing is not always offered for PFAS. It's also not always covered by insurance, and it's an incredibly expensive test. It runs around $700 to $1,000. So we really want to arm nurses with advocacy tools so that we can advocate for insurance plans covering these kind of things and these kind of tests becoming more routine and more accessible for people. The labs that offer PFAS testing are not subject to measurement and standardization. They don't need to comply with clinical certification for reporting of results to patients. And we do have in our toolkit the lab codes so that you can order tests for your patients and which EPA methods are required for that. And this is all in our toolkit, and that link will be in the chat. Dr. Kerrigan also discussed this. There's clinical guidance in our toolkit, how to follow up after PFAS testing. So you get the labs drawn, and then you want to be able to explain to the patient what this might mean for them. So we know that if there's increased exposure, there's increased health risks. And then we also know that with PFAS levels greater than 20 nanograms per milliliter, there's likely a higher risk of health outcomes. There's also a number of things in our toolkit about clinical management. If we have elevated levels of PFAS through testing, there's additional testing and follow-up consideration. And as Dr. Kerrigan said, a lot of these are part of regular routine examinations, things like examinations for testicular cancer, breast cancer, ulcerative colitis, blood pressure monitoring during pregnancy. And then there's also potential lab tests for follow-up care. And one of the main things we want to do is we really want to talk to our patients. They are likely to have questions about pregnancy and breastfeeding and what are the implications of their test. So we just wanted to put together a toolkit to inform your practice. We will put a number of links in the chat. But I want to thank you for letting me talk today. Here's the QR code. On our website, we also have a companion document that you can give to patients. And this is something that they can read and they can actually bring to their provider to help talk to their provider about PFAS. So there's some great resources on our website. And I'm going to go ahead and turn it over to Erica Bloom.
Hi everyone, our last speaker is Erica Bloom. For the last 14 years, Erica Bloom has worked in environmental and local food systems movements focusing on policy, coalition building, community engagement, fundraising, and program development. In her role as Toxics Campaign Director at the Ecology Center, she leads the Great Lakes PFAS Action Network and supports community-led science through the organization's Healthy Stuff Lab. Her previous roles included policy manager at the Michigan League of Conservation Voters and assistant director at Growing Hope in, I'm not sure how to pronounce this, but Ypsilanti, if you can correct me, Erica, Michigan. Erica has an MS in Environmental Health and Justice from the University of Montana and a BA in English with a concentration in Environmental Studies from Kalamazoo College.
Thank you so much. And yes, you were right. It's Ypsilanti. It's my hometown. So I'm going to be talking today a little bit more about kind of advocacy and policy and how nurses and health professionals can be involved and really lend your voice to move some needed actions. I will be focusing on Michigan, but I see there's lots of folks from all over. And so lots of these things can be relevant in your own state as well. So next slide. Sarah, can you move the slide?
Is it not moving on your end?
Nope.
One moment, sorry. Are you able to see it now?
I cannot see it. Am I the only one that can't, or can others? Otherwise, I can share my screen. I have it up.
You might be the only one who can't see it.
Really? You can see it? Everybody else can see it. Okay, that's strange. Okay. It looks like it did move now. I can see it. Thank you. Okay. So this is Sandy Winstelt, who Courtney already spoke about. I work closely with Sandy as an impacted community member. You know, a lot of my work is supporting community members who have been exposed to PFAS, either in their occupation or through their drinking water. Sandy is a real kind of is a real spokesperson here in Michigan and nationally. And she's really her story is really about, you know, the threats of health, you know, what the health threats have been to PFAS, and what she's doing as a community member to really advocate for change. So I always like to share her story. Next slide.
Is everyone able to see that?
Okay, something must be going on my end because it looks like you haven't moved the slide. Maybe it would be easier if I shared my
Okay.
screen. For whatever reason, I'm not seeing you moving the slides. So let me just make sure here that I have this.
And while you're setting up your slides, I see we have some questions coming up in the chat. So Dr. Kerrigan, I'm not sure if you wanted to address any of these, or one of the questions was about artificial turf fields.
I saw that question. I've done a little bit of work on artificial fields in the sense that people have been asking questions about them, but I don't have any good answers except that it seems like we can measure some PFAS being used in the plastics of artificial fields. But it's unclear, you know, how much is migrating into, you know, through soils, potentially into drinking water and groundwater, or surface water, or how much exposure. I think one study recently reported it on the soccer balls themselves. So I think it's a question that's still out there. I don't have a whole lot of information except to sort of, you know, suggest caution about PFAS being used in things like this.
Okay, great, thanks. All right, Erica, I'm going to turn it back over to you.
Okay, so these are my slides. Everybody's good now. We can see them. Okay. Yeah, so I wanted to start really by grounding us in what nurses can do to take action. You know, many of you know, I don't have to tell you, you have a unique perspective as nurses and ability to really persuade. I was kind of researching a little bit about your profession, and according to a Gallup poll, 78% of US adults believe nurses have high honesty and ethical standards, which is actually the highest profession out of the poll. So that being said, you are a trusted voice, and lawmakers really need evidence-based data for decision making. And like, you know, many of the population trusts nurses and health professionals to provide that. Through our networks, we have community members that we are, you know, uniting and doing advocacy around. We really need nurses and health professionals to lend their voices to support community members who have been impacted, and maybe some of you have seen that in your own, you know, in your own office. So I'm going to cover, like I mentioned, policy solutions, current Michigan legislation, and a little bit more on some action. I am going to focus on Michigan, but again, this is, I think, relevant throughout the country. So why are we focusing on states? Because this is a problem that's affecting us across the world and in the United States. So why aren't we acting more, pushing federally? Well, we are pushing federally, but as many of us probably are aware, things happen quicker, can happen quicker in the states. That the states have been leading on many of the policies to push Congress and the administration at the federal level to take action. And that's needed because there are a few enforceable federal PFAS laws. Like Courtney mentioned, there is a new PFAS drinking water regulation from the EPA, which is a huge deal and will affect states regulating PFAS in drinking water. But in terms of legislation around what's prohibited, PFAS prohibited in products, from our household products, the states are leading on that. And so that's why we're really focusing on having states be able to, take some of these policies and pass them through their legislature. In Michigan specifically, our work, when I think about kind of the progress that our state has made, I think about some of the things the administration has done over the last few years to really make an impact. And that's everything from the governor doing executive directives to regulatory action from our Environment, Great Lakes and Energy Department, putting funding for in the state budget to deal with contaminated sites and identifying contaminated sites. Our Attorney General has been very proactive on issuing lawsuits against PFAS manufacturers. Michigan has some of the strongest drinking water standards for PFAS, which again, now that we have a federal, drinking water standards, we're in some ways already doing that. And whereas other states that haven't had any drinking water standards will really have to catch up. So it's good to see at the administrative level that Michigan is really being proactive and taking this issue very seriously. And we're spending a lot of money on it. And that's the unfortunate part, is that the costs to do a lot of these cleanups and deal with the health impacts, it's very costly. And so how do we deal with kind of the source of it and make sure that, we can turn off the tap, as we say, instead of looking at downstream solutions. So really what we need is state legislators to pass policies that are preventing PFAS contamination at the source, funding testing and cleanup, which I was talking about a bit, support impacted communities, and hold PFAS polluters accountable. So I'm going to go through a couple of these kind of big buckets fairly quickly. And then obviously, if there's more that you want to know, you can always reach out to me. But policies that support contaminated communities. In Michigan, we're really looking at, how do we create programs that fund medical monitoring? So the people who have been exposed to PFAS don't have to wait until they get sick. They can actually do blood tests. They can actually have their fees for blood testing and for other medical monitoring that Courtney was talking about paid for by the responsible party. We're looking at better notification of private well owners when contamination occurs in their communities. We want insurance companies to cover blood testing for PFAS. And we really want our statute of limitations to be updated so that people who have been exposed to PFAS have a longer window of opportunity to sue the responsible party. We're looking at policies that support impacted farmers to set up farmer relief funds for those that find contamination on their agricultural land, that they're not left out, losing their business, which has happened in Michigan, and in Maine is another good example of many farmers who have found PFAS. But they're really leading on policies to protect those farmers. And we're looking at, biosolids, how much PFAS is allowed in land-applying biosolids that contain PFAS. Like I mentioned, these turn off the tap policies are super important. We're looking at Minnesota, who last year passed a very strong ban on intentionally added PFAS in products. And right now it's a very comprehensive bill. It's a huge win for the Great Lakes. And we need other Great Lakes states and other states to really step up as well. So in Michigan, we now have introduced a bill, and I'll talk about that in a bit, the Hazardous Products Act. And it bans PFAS in AFFF firefighting foam, as well as other product categories like food packaging, cookware, textiles, furniture, cosmetics, cleaning products. That one doesn't ban in biosolids, but some other states have banned PFAS in biosolids. Allocating funds, something I talked about earlier, is that states need resources to deal with this issue. They need resources to do testing, identifying contaminated sites, doing research on, crop uptake, et cetera, and really looking at how to remediate and dispose of these chemicals. And then accountability policies. These are, things that the community members that have been impacted would really want to see. That the burden of paying for these cleanups and health costs don't fall on people who have been exposed or are vulnerable populations or living in these communities. We really want to see responsible parties be liable for mitigating and cleaning up. Wolverine Worldwide here is an example of a larger industry that has been in the community for a long time and is starting to pay for some of the cleanup. This is a little bit more for those that are very interested in knowing what our bills are. These are the bill numbers and the sponsors of the bills and which committees they're in. This is taken directly from our Great Lakes PFAS Action Network policy agenda, which impacted community members came together and prioritized the policies that they really wanted to see us work on. So I mentioned both of these, the statute of limitations and the medical monitoring, both very important to community members because it's making sure that they are supported in being able to seek both legal justice and get their medical, fees covered. A little bit more, the PFAS Hazardous Products Act. So currently this bill restricts PFAS in household products, but it also restricts PFAS in all what they call non-essential PFAS in products. So the only way that, again, this is a phase in. So by 2032, PFAS will be prohibited in all products unless the state of Michigan kind of uses a criteria to deem the PFAS in the product is unavoidable. So it's getting to a little bit more of that, okay, let's just ban the PFAS that we know there's already alternatives for and that show up in many of our household products. But then PFAS are used in all kinds of manufacturing and in industries. And those are the ones that we're also really concerned about, but are harder to get out of our economy right now because either there's not an alternative that works or is not regrettable substitution, or this one, has a lot of political pressure to continue using PFAS because it can be profitable for those industries. And then we also are looking specifically at food packaging, which, as Courtney mentioned, the FDA has announced that there is phasing out of some of these in food packaging. So that's a very good thing, but this one is introduced as well. And I want to talk a little bit more about our coalition. So we are, as I mentioned, we're driven by PFAS impacted communities, and then the support, kind of policy, organizing, communications support comes from organizations like mine, the Ecology Center, the National Wildlife Federation, and the Michigan League of Conservation Voters all kind of support the coalition. And in addition to kind of passing and looking at policy, we're really looking to connect and resource community members who have been impacted across Michigan and other Great Lakes states. We're trying to build broad awareness and citizen engagement on PFAS issues and educate state and federal decision makers. And this is some of us, like a good amount of us at the National PFAS Conference in Ann Arbor this year. So just to get back to what you can do, whether you're impacted or not, you're working in the healthcare industry, and it's so important to start to know, what are PFAS, like what are some of the correlations with health impacts, what are people asking, like what kinds of questions people are, what do they need to feel supported? A lot of times, just working directly with people impacted, it's about being able to listen to them and hearing about, where they live and what kind of water they're drinking and, any kind of occupational exposure they might have had. So just kind of knowing some of those questions around, where PFAS might be, they might have gotten exposed it's important. A lot of people don't feel like they are listened to or have the opportunity to share. So I think just being there, listening and educating yourself is really important. And then again, this came up earlier, becoming familiar with any contaminated sites in your area. Michigan has a map, like a GIS map from the state, where you can look and see all of the different sites. We have about 290 contaminated sites, and you could click on a link and see all about that site. And so that's a really good way if you live or work in those areas to be really aware if patients are coming in. And then finally, I'm working a lot in the legislature. Like I said in our first slide, the health professionals and nurses are really critical voices. And so we really need folks like you all to be talking to your lawmakers, coming to meetings with us, sharing. You don't need to know all the science. You don't need to know, every detail about PFAS. You just need to be able to talk about your experience as a nurse, why this is critical in the work that you're doing and some of the things that you see for patients. Hopefully we will have some hearings where testimony, written or oral testimony can happen, or even just writing opinion letters to your local newspaper. All of these things make a difference, and lawmakers look to that to kind of help them make decisions. And I just wanted to go back to the medical monitoring, really, to put a finer emphasis on that one. It's crucial that nurses and health professionals are talking about the importance of medical monitoring. Sandy, who has shared her story many times, one of the reasons she got help and is, able to, be healthy right now is she was able to talk to her doctor about some of her exposure, and they did some preventative tests. They took her blood, they screened for thyroid cancer, and she's really someone who talks about that because she worked really closely with her doctor. And I think the more health professionals that can kind of be aware and listen to their patients around this, the more lives will be saved. So that's something that we're really hoping to see get some action in the legislature. Finally, if you would like to get more involved with our coalition, we have some more things that are happening in Michigan right now. We will be doing a webinar on Monday, kind of talking about some similar legislative and policies that I've mentioned here. And then we have an email action alert that would send to your state reps and senators telling them about the bills that I mentioned and to take action on those. This QR code goes to that action alert if anyone is interested. And then finally, the Great Lakes PFAS Action Network has a website and an email listserv if you're interested to learn more and get involved. I put our links up here, and my email is on there as well. So we'd love for you to get involved and learn more and lend your voice. And I will stop there. So thank you.
Thank you so much, Erica. This was so much great information from both of our speakers. I'm going to stop recording